all those in the most vulnerable groups on course to have been offered their jabs by the middle of the month. And we're past the peak of this outbreak, according to the Chief Medical Officer, Chris Whitty. So you might expect that the nation's booster-in-chief, the Prime Minister, would now be promising that schools would soon reopen and we could all start thinking about getting back to something closer to normal life. Not a bit of it. Yesterday, Boris Johnson sounded very cautious indeed, which is leading some in his own ranks to mutter that he's moving the goalposts by delaying the time lockdown will be lifted again. So facing criticism this morning about why it's still not produced a plan to put people arriving in the country from so-called red zone countries, those where there are new variants of the virus, into hotel quarantine. Earlier, I spoke to the chief executive of the Best Western hotel chain, Rob he had misspoken. I've been speaking about all of that with the Vaccinations Minister, Nadhim Zahari, but I began by asking him to explain why the Prime Minister yesterday had sounded quite so cautious.
Well, I think you have to be cautious when you still have 33,000 people in hospital with COVID, and of course people dying from it still at a very high level. Some days it's over 1,000, and until we vaccinate the most vulnerable cohort, so the top 1 to 4 is 88% of mortality. We aim to get them the first dose by mid-February, hopefully hospitalisation and, of course, on death. And that is the roadmap that the Prime Minister is talking about, of setting out on the 22nd of February, and then hopefully the opening of schools comes first, and then the rest of the economy beyond that.
But you are prepared to say to your backbenchers who are getting restless, aren't they, and getting impatient, that schools in England will open later than schools in Scotland, because you think that's a wise and sensible thing to do?
Well, firstly, so if you go those most vulnerable cohorts, the 1 to 4, which is 88% of mortality, and then if you allow a little bit of time for teachers to prepare, then you get to the 8th of March, which I think is sensible and it's the right thing to do, because we want to reopen schools, reopen our economy, get our lives back, but never have to go back into another severe lockdown like the one we're all experiencing and suffering from at the moment.
You see, what people want to know is what the goalposts are, and some think the burden on the NHS by reducing hospitalisation rates. Is that it? Or are the scientists saying to you, no, you've got to worry about the number of cases in the community as well?
Well, I think you've got to make sure that your vaccination programme has protected the top 9 categories in phase 1. That is 99% of mortality. Chris Whitty put out a slide yesterday, which I'm sure you saw, which just so clearly demonstrated the... So mid-February is our target. We haven't set a date yet.
Not for the over 50s, is it? The over 50s is later than that.
Correct. So over 50s is category 9. But we absolutely are committed to coming back on the 22nd of February to Parliament about the roadmap.
Forgive me, you've said that. When will you have done the top 9? In other words, the over 50s?
Well, we haven't yet put a date. Our absolute focus now is the mid-February target for 15 million people in the United States.
Forget the 8th of March. Not until we've done everybody over the age of 50 can we really talk about getting back to life anything like normal.
Well, we'll do that as quickly as possible, and you've seen the progress to date, the 10 million mark yesterday reached. But of course, the Prime Minister has made it very clear that on the 22nd of February, there will be a roadmap for how we intend to reopen the economy, beginning with schools on the 8th of March. And you hope everything goes well. But these things are changing. Other countries are having to do the same thing. You look at Germany and Canada, both had to re-look at their border policy in January.
I'm glad you raised border policy, because you have a border policy still, do you? We were told that the government was going to put people into quarantine hotels when they arrived in the country. Can you confirm whether that is still the government's policy?
That is the government's policy, Nick.
Wait, so is he going to present it tomorrow?
No, but what I'm saying to you is
well, we were told at the beginning of the week that we'd have a plan today. The Prime Minister said yesterday that Matt Hancock would have a plan today. There is still no plan. Why not?
Well, first of all, it is part of a much bigger plan, because if you come to the UK already, you have to quarantine for 10 days. You have to have a test within 3 days before travel. So we already have a robust border policy.
Well, you say robust, Mr. Zahari. There are no quarantine hotels available, and we've been told by the boss of Great Western Hotels, one of the key chains involved, there's no plan yet for them. There are no tests when you arrive. There is nothing to stop you getting on the bus or the tube or a train when you arrive at the airport. And if you do go home, there are very few checks, and if you don't comply with the rules, there are almost no...
You have to have a test before you arrive. The pre-departure test is now mandatory. People have to have that, otherwise they'll be turned away. When you arrive, you have to quarantine, even without the hotel quarantine operation yet in place. So the border policy, I think, with the passenger locator forms, where greater enforcement is taking place now than ever before, is robust, but we're going to go further with the...
This week, as we were told, he's setting it out next week. Do you mean setting it out? Or will there actually be a policy? Will there be hotels available next week?
It'll be the operations. It'll be the operation. The policy is set out.
Can I gently point out that it is 43 days since the South African variant was revealed here. It is 21 days since ministers first discussed a quarantine hotel plan, and you're still telling me it'll be days before the plan comes into operation. Have we learnt nothing?
Well, it's one part of a much greater border policy, which is that everyone has to quarantine for 10 days. People, every port and airport will see have already seen much greater police presence, finding those who are in breach of the stay-at-home regulations. People can't travel unless there are very specific exemptions, and they have to actually have a very clear and declared reason why they'd be travelling. So,
from the police recently, that a fifth of people are either not at home when they go round to check whether they're self-isolating, or are not complying. It isn't robust at all, this policy, is it?
Well, the police have issued over 40,000 fines, and I make no, there is absolutely no apology for that, because I think it's the right thing to do, to have a robust system of compliance, and that the fines work, and they continue to trace. 7 million people now have been identified and have isolated. That's the right thing to do. It's a combination of strong international border controls, reacting to them. Germany only put in border controls from those countries with the new variants in January, as did Canada. And we've done similar things. When we found out about the new variant on the 18th of December, the Prime Minister acted on the 19th, within a day, to introduce Tier 4, and then moved on to
of hotel quarantines weeks before. You mentioned tracing. Can I just go back to your responsibilities, finally, and ask you whether you are tracing who is and who is not getting the vaccine, in particular people who may be refusing to take up the vaccine, because there are some worrying new figures out from the London School of Hygiene and Tropical Medicine, and that white people are twice as likely to have had the vaccine as black people, and given that black people are much more likely...
So vaccine uptake in the UK is running incredibly high amongst adults, 85% according to the ONS study, but the 15% who are vaccine hesitant skew heavily towards BAME communities, which is why I am spending a lot of time with the NHS to make sure that we record, of course, ethnicity, but also have a strategy of how we reach those hard-to-reach groups, working with local government. We've got the Prime Minister visited the Hikma Centre in Batley with the Muslim community there. Again, that made a huge difference to the uptake of the over 80s, which is now, we've vaccinated over 90%, over the 75, 90%. But we've got more to do, especially with the workforce, both in care homes and, of course, the health and social care workforce. But we are absolutely focused on this area, and you'll hear more from me on this in the coming days and weeks.
Some have seen, and who has not? Is that correct?
Not true. Everyone who's had the vaccine goes into the national immunisation and vaccination system.
Yes, but does data get recorded saying we called Mrs. Smith or we called Mr. Patel and they said no?
Oh, you mean in terms of people who are refusing the vaccine?
Correct.
Vaccine refusal. So at the moment, the uptake is so high amongst the four cohort, the people who look after them.
So the answer is no, you're not recording who's refusing it, shouldn't you be?
So we absolutely will look at how we are addressing the issue of refusal rates. At the moment, this is the highest uptake of any vaccination program, including all the flu vaccination programs that NHS have run. So currently, the good news is the UK is a standout country in terms of people actually wanting to keep themselves safe by being vaccinated and, of course, keep their families and community safe as well.
Sounds like work in progress. Nadhim Zahari, Vaccinations Minister, thank you for joining us.
Hello, this is Breakfast with Naga, Munchetty and Charlie State.
Good morning to you. UK's pushing on with vaccination drive. Scientists continuing to study new ways in which the jabs can be used.
The latest attempt is to determine whether using different vaccines for the first and second dose helps the body develop better defences against COVID.
Let's talk to the Vaccines Minister, Nadhim Zahari. Good morning to you.
Morning, Naga.
Morning. So should we pick up on that, the idea that the different vaccine products, different vaccines can be used for the first and second administered dose? Can you explain the thinking behind that?
Yeah, absolutely. This is a study that we have just funded through the Vaccines Task Force to the tune of about £7 million to look at the effect of using two different vaccines, polio, measles, mumps and rubella. It will hopefully maintain the UK at the forefront of research into COVID vaccines. We're very proud of our track record, obviously, another part of the armoury. Now, it's very important for your viewers to know that it will not impact our deployment program. So if you've had a Pfizer-BioNTech vaccine as your first dose, you'll get a Pfizer-BioNTech vaccine for your second. If you've had an Oxford AstraZeneca vaccine, you'll have the Oxford vaccine as your second dose.
What's the timeline for that changing? What's the timeline for that potentially changing?
Well, there is no, that will not change. This test will look at this. 800 patients will be part of this program. They won't report till the summer, and we'll look at the data when that comes through as to whether we change anything. At the moment, we're not changing anything at all. But what it will do, Naga, which is really important, because it's worth just reminding ourselves that, of course, we will vaccinate the UK adult population as fast as we can, and we're aiming to do the top four cohorts, so the most vulnerable, by mid-February. But no one is safe until the whole world is safe, which is why it's important that we continue to research and look at ways of how we can vaccinate vast amounts of the population of the world as quickly as possible. Yes, I am. Okay. I have an incredible...
So if that is met, under consideration.
So just to be clear, Naga, the top four is only part of the phase one. So we then go on to 5, 6, 7, 8 and 9 and complete phase one. Then we're going back to the JCVI and asking them again to look at, for example, key workers. The Prime Minister quite rightly talked about yesterday in the press conference, teachers and policemen and women, shop workers, people who through their profession will come into contact with the virus in much greater volumes. We want them to look at that and advise us as to what we do. Now, many of them who are clinically vulnerable will have been picked up in phase one anyway, because that includes those that their GPs feel should be prioritized. So a lot of the key workers will be picked up in the 1 to 9 categories that we are focusing on delivering in phase one.
It's interesting that you pick that out. Interesting that you pick out and make very clear.
Well, first of all, as I said, so teachers who are in themselves clinically vulnerable will be in phase one.
Yes, anyway. I'm talking about overall teachers, because obviously all this is mindful, because the government set the target.
Absolutely. So if you take the mid-February target, that's 88% of mortality. If you work forward from that by 2 to 3 weeks, when the vaccine, the first dose, begins to offer that high level of protection, that puts you in that first week of March that the Prime Minister talked about, reopening the schools and then gradually reopening the rest of the economy. The phase one, the top 9, is 99% of mortality. So I think we should be by then having really good, robust data. We've got two sets of data that we're waiting for. One is in care homes, where Public Health England are testing residents of care homes because they're in category 1, and one with health frontline workers who are category 2 of that top 9. Those pieces of evidence, coupled with other pieces of evidence from other countries as well, will hopefully give us a very clear roadmap to opening the economy, where we see a huge reduction, hopefully, of deaths.
Indeed.
And of hospitalisation.
I think you may have misunderstood my question. My question was, what's the target?
Forgive me, you're absolutely right. We haven't yet set a target date. My absolute focus is on mid-February. As you can imagine, 8 weeks ago, we literally vaccinated.
I understand that your target date is mid-February, but you will also understand that people want to know when they're going to be vaccinated. And in 10 days away, you've got February 15th. When's the next target? You've got to be looking forward and planning, surely.
We are, absolutely, and we'll set that out, and I'll come on your programme and talk about it when we set it out. We reached 600,000.
So we won't hear before February the 15th?
So we'll set out our target after we hit the February 15th target, but you can do the maths. We did a 600,000 in a single day, so the deployment infrastructure that we've built can do as much vaccines as we get supply. So the limiting factor will be vaccine supply. But you can see that, in the next 10 or so days, we've got to do another, almost touching 5 million. And so we keep that rate up, we will very quickly go down the list of
let's do the maths then while we're on air. 10 days you can vaccinate 5 million people. You are
categories 1 to 9 in total is about 32 million, of which 1 to 4 is 15 million. So
17 million. And how long has it taken to vaccinate 15? Or if we're vaccinating 5 million people for 10 days, so we could be looking potentially at 35 days from the 15th of February to vaccinate categories 5 to 9. Is that a reasonable assumption? Even better if the supplies improve.
That assumes the supply. So I don't want to commit to a date without going through with a very fine tooth comb with the whole team, because our limiting factor is the supply of vaccines ultimately. And as you know, that with any manufacturing process, especially one that is new, there are challenges around that, as we've seen in Europe, and of course, as we saw in the early days in the UK as well.
Just got a couple of questions regarding quarantine. Later on, it was said that no, that was a mistake. Now, did the Prime Minister make a mistake, or has that decision to announce today been delayed?
No, I think the operationalising of the hotel quarantine, which is, by the way, Naga, is one part of our border policy, includes obviously now pre-departure testing, and of course much tighter controls, and as you quite rightly mentioned, the passenger locator forms, where we know exactly where people are staying. They've got to quarantine for 10 days, is only one part, but that will be announced next week.
That will be announced next week. So did the Prime Minister make a mistake, or was it delayed? Was the announcement delayed?
No, I think the announcement was always going to be made when the operation of the hotel quarantine is ready. And it was I think the Prime Minister was saying within days, but if he said...
No, he said it would be today. He said it would be today.
Well, my understanding is it was always going to be within the next few days.
People are asking why we can't relax the rules a little bit quicker. You'll be aware.
Absolutely right. And I think it was good to see the Prime Minister reiterate that point last night at the press conference to the whole nation. We have to be really, really careful. We're seeing some good evidence, not yet obviously peer-reviewed by the Oxford team, of transmission rates being reduced by 2/3 of the Oxford AstraZeneca vaccine. Similar evidence in Israel with the Pfizer-BioNTech vaccine, but we have 2 big studies looking at this, and as soon as we have more evidence, we'll be able to share that with the nation. At the moment, please follow the rules. Make sure that you continue to observe social distancing. This new variant is incredibly infectious and loves social interaction. That's how it moves, and until it begins to capture someone who's most vulnerable and sadly really, really hurt.
One quick word, just to be clear as well, by the 15th of February, that means that everyone would have had their first doses. That doesn't include second doses, does it? in categories 1 to 4? OK. Thank you. And do you have a timeline for that being finished? Second doses for categories 1 to 4?
So that we, as I said, we then keep going with both first dose, but we start second dosing from March because of the 12-week interval. So second doses begin, and we keep first dosing as well. And on the 15th, we'll set out exactly our timeline for both more of the first dose all the way to 9, and of course the second dosing, which will just carry on as normal because anyone who's had first dose will have their second dose within 12 weeks. That's just an operational thing that the NHS will deliver.
Nadhim Zahari, Vaccines Minister, thank you for your time with us this morning.
Thank you.
7:43, nice and calm. And really, Carol, I hope you can see that. Looks rather beautiful, doesn't it?